Okay, good afternoon, everybody. I want to begin today's press conference by urging congressional leadership in Washington to prioritize and pass a second economic relief package as soon as possible. We've heard some news from Washington today that a deal is close to being reached, and it's welcome news, long overdue. They need to get it done. For the past several months, congressional leaders have stalled and squabbled, while Kansas families and businesses have been dealing with the consequences. Relief funding to support unemployed Kansans, small businesses, and vaccine distribution will be paramount to protecting our state's long-term economic health. In addition, Congress needs to extend the deadline for spending the CARES Act funding, the initial stimulus plan. Without any extension, many communities will have to forfeit funding that they desperately need. Senators Moran and Roberts have introduced legislation to extend the deadline, and I thank them for that. I encourage the entire Kansas federal delegation to push their leadership to act now. Kansans need help. Now for the COVID-19 numbers update. Since Monday, Kansas has reported 4,551 new cases and 144 new deaths. This brings us to a total of 194,569 cases, 6,050 hospitalizations, and 2,253 deaths. Last week, Kansas reached yet another unfortunate milestone. We lowered the flags for this. We surpassed 2,000 deaths from COVID-19. The rate at which deaths have been increasing in our state is alarming. To give some perspective, it took a little over 7 months for the first 1,000 coronavirus deaths to occur in our state, from mid-March to mid-October. It took less than 7 weeks for the next 1,000 deaths to occur, from late October to mid-December. This tragic uptick in deaths has affected every corner of our state, but has been particularly significant in our rural communities where access to healthcare facilities is limited and the population's average age is higher. Gove County, Kansas was recently featured in USA Today as an example of how COVID-19 is affecting rural America. As of last Thursday, the virus had killed a higher percentage of Gove County residents than any other county in the United States. Gove County has lost 1 of every 132 residents. Throughout the pandemic, I have said time and again that we must not become numb to rising cases and deaths, not forget that each statistic represents a real person, a friend, a neighbor, a loved one. Trevor Hughes, the author of the USA Today article, does an excellent job illustrating the virus's profound and devastating effects on Gove Countyans. Today, I want to read just an excerpt from his article. He writes, "Here in Gove County, where most everyone knows most everyone else, the pandemic has killed farmers and their wives, the town's unofficial historian, the beloved grandmother whose sour cream chocolate cake with chocolate fudge frosting was always the talk of the party, the mom whose piano playing still echoes in the heads of her friends. It strained the hearts of the survivors, those who feel guilty that they recovered, the ambulance workers battling to treat their own relatives, the exhausted doctor who watched nearly half of his patients die. I offer my sincerest condolences to the people of Gove County and the surrounding communities who are coping with these tragic losses. And for his efforts to protect Quinter and Gove County residents, this week I want to commend Dr. Scott Rempel, the county's health officer. At 30 years old, Dr. Rempel serves as a staff doctor at the local hospital and as the nursing home's medical director on top of his duties as the county health officer. He and his staff have worked hard to take care of the Gove County community, to promote sound public health practices, and to stop the virus from spreading further. Dr. Rempel and his colleagues deserve recognition and thanks for their resolve and service to their community, and I wish them strength in the weeks and months ahead. Now moving to a little better news, my administration's all of the above approach to the virus mitigation continues to make significant progress. Today, following months of work, we have measured evidence that the unified testing strategy is succeeding in its goal of increasing testing capacity statewide. As of yesterday, Kansas was ranked 5th in the nation for increasing our weekly COVID-19 testing, a tremendous improvement from where we were when I announced the unified testing strategy in September, which was near rock bottom. We've continued to add free testing locations across the state, which Kansans can find at gogettested.com/Kansas. Currently, 24 locations are available on the site, and we expect to add 19 more by the end of this week. I encourage all Kansans to take advantage of the free testing opportunities at these sites. As I've said before, this type of widespread screening is key to catching asymptomatic carriers and stopping the virus spread early. Let's remember the slogan for our new statewide testing campaign, "Stop the spread, it's up to us, Kansas." Additionally, the Kansas Leadership Center's Kansas Beats the Virus network continues to grow as more organizations and communities sign on to hold convenings. As a reminder, this network's ultimate goal are to dramatically increase local actions to slow the spread of COVID-19 and encourage Kansans to practice critical virus mitigation methods. So far, members have held 184 meetings, with another 533 scheduled and commitments to hold over 1,000. The innovative ideas and action items produced from convenings held so far are impressive. In Chapman, Kansas, the Irish Den coffee shop is creating a heated outdoor space so that customers can still get their daily dose of caffeine safely through the winter months. Students at the North Central Kansas Technical College are creating quarantine kits. Each kit contains health information, some basic supplies, and a few fun items to help make quarantine easier for students. Shop owners in Hutchinson are creating, love this one, sanitizing stations in the city's downtown district. Each station offers shoppers hand sanitizer and free masks, making holiday shopping even safer in Hutchinson. With a combination of my administration's continued support and these inspiring examples of local Kansans' ingenuity, I'm more confident than ever that our efforts will produce positive results. This existing infrastructure of community leaders and advocates will be valuable as we move forward in our vaccine rollout plan and ensure Kansans statewide have access to accurate information. On to vaccines. Our first shipment from Pfizer began arriving in Kansas on Monday, about 24,000 doses. We still expect Moderna's first shipment of 49,000 doses next week. Pfizer's vaccine was received in several ultra-cold storage locations across the state, and from there the vaccine is being distributed to sites across Kansas. This morning, over 600 Stormont Vale Hospital frontline healthcare workers became the first people in Shawnee County to receive the COVID-19 vaccine. At a press conference following the first shots, Stormont Vale CEO Dr. Robert Carnegie said, "Today, as we get to talk about one number, the number one, as in day one of the end of this scourge of the pandemic that has impacted us so significantly. I hope that Dr. Carnegie's message inspires everyone to get vaccinated. It's a reminder someday the pandemic, the quarantining, the remote learning, the carry-out-only dining, Zoom meetings will be over. Not tomorrow, not next month, but in the foreseeable future." You know, Dr. Anthony Fauci, the nation's top infectious disease expert, said this week that the U.S. would most likely not be able to return to some semblance of normalcy until late next year. So until then, we must remain vigilant. We must wear face coverings, physically distance, avoid gatherings, practice good hygiene, and get tested. And with that, I'll take some questions.
I'd like to start by asking about teachers fitting into the COVID vaccine priority, and the fact that unions are pushing for it. They're considered essential workers by the CDC, and vaccine could get them back in the classroom sooner. If so, potentially by what month, or how many could get vaccinated, and what's a reasonable time to expect a return to school?
I think you can see if you look at the chart you've got teachers who are right here, so they'd be at the beginning of phase 2. After we take care of all the folks in long-term care and in our frontline hospital workers.
Governor, what's the thinking of doing all the folks in long-term care first? And have any of those folks started getting shots? The residents, I mean.
I don't believe that they have started the long-term care shots yet. I believe that will begin next week. And the thought behind that is if you take a look, whether you're looking in Kansas or you're looking all across the country, you know, the percentage of deaths are coming, the highest percentage are coming from our long-term care, our congregate living situations. And so it's absolutely imperative that we get those folks who reside in those settings vaccinated, just quite honestly to prevent their death.
As you expand the universe of people who are eligible for this priority access, how do you screen these people when they present the deal? I guess I'm asking about line jumpers and people who want to get to the front of the line and that kind of thing. How do you verify that the people who are coming to get the shots are actually in these categories?
Well, that's probably a good question for you, Dr. Norman.
Yeah, good question. And I think the best answer to that is, one, the people that will be administering the vaccine will ask the reason that they've registered for the vaccine. And secondly, we're hoping that people will self-police and that the spirit of goodwill and community spirit will carry the day. That, I think, is the most humane way, I guess I'd say, to manage people and treat them as adults that want to contribute to the greater good.
Dr. Norman, I have a couple of questions for you. One viewer that we have asked if their immune system is open due to medication for arthritis or anything else, will they be able to take the COVID vaccine?
Yes.
And also the second question is, you know, we're expecting a limited availability of the vaccine for the next few months, and the vaccines that are currently being brought in will be used to administer a single dose of the vaccine. Why is the state planning to use that particular method as opposed to 2? And is there if there's an unforeseen shortage in supply perhaps, what is the plan to address that? Will one vaccine be enough in the meantime? And how will the state make sure people come back to that second shot?
Yes. The people will be scheduled for their second shot when they get the first shot. The 21 days for the Pfizer vaccine interval to the second shot, or 28 days for the Moderna, means it can't be given before that, but it can be given after that. There's not a great deal of lost if a person comes not at 21 days with Pfizer, but comes in at 27 days or 32 days. So, I mean, it's not, you just can't have it too soon. So the second dose, you got a little bit more wiggle room.
And with that chart, are we going to get a little bit more clarity on months or particular dates when the rollout is needed?
Yes, this is, I would consider this draft number 1, quite honestly, both in terms of the exactness of the dates and in terms of how much we're splitting out different categories within categories, because this doesn't answer all the questions yet. We are working with the Advisory Committee on Immunization Practices, who not only are they evaluating safety, but they're also doing a risk-based analysis of who and where upon this list of how soon or how much later can they be prioritized.
Doctor, why are we, with the case counts kind of drifting downward, still high, but drifting downward,
Yep.
Why is the state seeing this surge in deaths? The worst 7-day period since the pandemic began.
Well, I think the question is about the surge in deaths and why do we have big peaks like what the governor reported on today. And some of this is a batching situation in terms of when does data get entered in. For example, some of these are people that passed away. It could be even a few weeks ago. We're acting upon the death certificate because it takes a while to go through. All death certificates, you'll recall, are signed by a doctor, a coroner, or a medical examiner. And it takes a while for us to get that. And that patient who was signed out as cause of death being COVID-19 may not have ever been put into the epidemiology tracking system. But also there's the holiday phenomenon too, where things get batched up.
Doctor.
Oh, I can ask one question, I'm sorry, to the governor after.
Okay.
Yeah.
Yeah, Tim, that's a great question. About people that live out great distances or maybe live alone. We're hoping that family or somebody will know that person, will rely on everything from law enforcement to the local health departments to do that kind of an outreach. And we want to make very certain that they're not forgotten.
Secretary, real quick, is Pfizer and Moderna, is it interchangeable? Can you have a dose of Pfizer and then Moderna later, or?
No. If you have Pfizer as the first one, you get Pfizer as the second one.
Okay.
And by the way, people will all get cards that they can carry with them, that they will carry with them, that have their return date and which was the first product they got.
And is there too much difference between the two?
There's enough difference that the FDA doesn't approve them to be interchangeable.
Before your question, if I could just respond a little bit further, Tim, to your question about how will we reach those folks in our really rural areas. You know, I think you've seen what we're doing with the testing and the amount of social media that we're using, the amount of television that we're using, you know, to really get the message out that this is there. And, you know, people are able to go on the website and see, you know, here's the site, where we can go. So hopefully, you know, that will help reach these folks. We have intention of doing the same thing with vaccination locations, so that people will have sort of a one-stop to go to be able to find out where they need to go, what they need to do in order to get vaccinated.
Governor, in Reno County, two of the three county commissioners have said that they are looking at reconsidering the mask mandate there. And one of the county commissioners sort of told the health officer down there that the mitigation efforts are not, in his words, moving the needle, and it's an infringement on personal rights, the mask mandate and the gathering limit, and it's not doing anything, and compared to other states. And what's your response to that?
The research dictates very clearly that masks work. Other mitigation efforts add to that. So, you know, I mean, we just need to look at the facts, we need to look at the science, we need to look at the data and make our decisions that way. One question.
Dodge City's mayor submitted her resignation due to threats and abuse she received after publicly supporting the mask mandate. I wanted to know what your thoughts are on that.
Well, I think it's very, very unfortunate that Mayor Warshaw and others, whether they're in elected positions or they've been in public health positions, have been personally threatened, or that families have been threatened. There's no place for that kind of stuff in today's world. We should, you know, this is a public health crisis. This is not a political battle to be won. So I think it's very, very unfortunate. But as long as I have the opportunity, I do want to thank Mayor Warshaw for co-chairing our census counts, our complete counts committee. She was extraordinarily useful in that, and I hope that, you know, some communities lucky enough to land her services